uterine prolapse or the prolapse of the uterus. So uterine prolapse is a very common condition. A lot of women suffer from it, and one of the common cause of it is weakness of the pelvic floor muscles. So these are the pelvic floor muscles which extend from the pubis to the coccyx, and this is the urinary bladder, this is the uterus, and this is the rectum. As you can see, all these vital organs are resting on the pelvic floor. So it's very important that pelvic floor is strong, firm, and has a good flexibility so that it can provide an adequate support to all these vital organs. But because of during menopause or after childbirth or during pregnancy, the pelvic floor can become weak or tight. So dysfunction may vary, but because of the dysfunction of the pelvic floor, sometimes the pelvic floor is not able to give enough support to the organs, and because of this, the uterus may descend or come down. So there are different grading. There are grading given to it, the level of according to the level of the descent. So if grade 1 is 1 centimeter above the level of the hymen, grade 2 is at the level of the hymen, grade 3 is 1 centimeter below the level of the hymen, but the total length is 2 centimeters shorter than the total length of the vagina. The role of pelvic floor physiotherapy is very, very important in case of pelvic organ prolapse or prolapse of the uterus, because if we can timely assess the pelvic floor and we can start with the stretching exercises of the pelvic floor, it can cause the muscle dysfunction to be reversed. That is, muscle to function properly. So because of the proper muscle function, the levator plate is slightly elevated. The entire levator muscles are slightly elevated, and because of that, the uterus can come slightly above, or the grade can be reduced. The grade to which the prolapse is present can be reduced. Again, it depends on what is the grade of the prolapse and how weak are the muscles. Also, if there is a tear or no, there are a lot of other factors which a therapist, after assessment and of the muscle function, will be able to tell you. And also how aware the sensory function of what is the sensory function of the muscle, as in the patient is able to appreciate the sensation in this muscle. So only after a thorough assessment, all this knowledge will be provided, and after that a proper treatment session has to be planned for the patient according to the severity of the symptoms, and there are very good outcomes. And I think most of the patients who have this prolapse are never even told about pelvic floor physiotherapy. So patients with pelvic floor dysfunction, organ prolapse, should be told about pelvic floor physiotherapy and should be referred to a pelvic floor physiotherapist timely, because a lot of hysterectomies which are happening because of weakness of the pelvic floor. Of course, there are other reasons for hysterectomy, but the hysterectomy which are happening because of the weakness of the pelvic floor muscles can definitely be avoided if timely patients are referred to a pelvic floor physiotherapist. So I hope this information which I shared through medium of today's lecture was helpful, and if you need any more information about how pelvic floor physio can help you if you are suffering from pelvic organ prolapse or uterine prolapse, please feel free to reach out. Thank you.